surprise, I suppose, for some people that around about 50% of heart attacks and 50% of patients with cardiovascular disease have normal levels of cholesterol. In terms of how normality for cholesterol is defined, I'm not going to go into, but there's this very strong overlap between cholesterol in patients with and without heart disease. And part of the reason is this, that cardiovascular disease is multifactorial. There are a number of risk factors. Cholesterol or lipid profile is only one of them. There are others, I've mentioned some already: blood pressure, smoking, metabolic status, whether you've got diabetes or not. Some others which are sort of relatively new to most people: socioeconomic status, and that may have an impact on a number of things, including nutrition, for example. Inflammation and infection, and I'll talk to you a little bit about that later. Obesity, and of course this may be linked with some of these other factors, so people who are obese also tend to have high blood pressure, also tend to have abnormalities of inflammation and infection, also have abnormalities of lipid profile. And then another factor which I have not talked about, which are genetic factors, which I will talk about in a little while. Now, where do we get this data from? And I think this gives you some idea of where the problems lie in terms of the risk calculators that we've used. Most of this data come from a place near Boston in the United States called Framingham. And they, in 1948, started a research project which is called the Framingham Heart Study, looking at a cohort of men and women, in this case about 5,000, who they followed up from 1948 over the next few decades. And